The judgment gets so rushed that because you have a child that has cavities, you have to sedate that child. It's a misnomer. It's not true.
I have a lot of kids who come into our office whose parents are seeking a second opinion about treatment. Maybe they've been to another office and had some treatment recommendations that include sedation, and they're just wondering, is sedation really necessary? We find that during the exam, I can kind of just see how things are going, and well over 95% of the time, just being pediatric dental specialists, we're able to get the treatment done without needing any sedation.
When we went to Pediatric Smiles, Dr. Shepard brought us in, and my 4-year-old nonverbal autistic son went in, and usually when you say the word autistic, dentists always go straight to, oh, he needs to be sedated. Dr. Shepard took one look at him and he said, I don't feel like he does. I feel like he will stay here.
Parents ask me frequently when we're making tough decisions on how to fix their kids' teeth is, what would you do if it was your child? And that's your gut check moment. If this was my child sitting in this chair right now, at this age, at this moment, with these needs, what would I do? My philosophy is always going to be, I will never do something to someone else's child that I would not treat on my own.
Here at Pediatric Smiles and Braces, we try to utilize a smart step approach to sedation. What that means is we are going to first make sedation our last resort. So as I'm seeing the child for exam, I'm trying to assess, okay, how comfortable are they? Is this something that's stressful for them? Are they super nervous? Are they able to have x-rays done without any issue? And if all that goes smoothly, then we can provide treatment in a way which we don't need sedation. Just with usually a little laughing gas and a movie, we're able to get all the treatment done. Sometimes though, just during the exam process, I can see that that's probably not going to be enough. So sometimes we'll need to use a little extra. So the smart step is I first think about the nitrous. If that's not going to work, then we might use a little oral sedative. And that they'll come into the office, they'll drink a little medication, just get take a little bit of the nervousness or the anxiety away, and be able to do treatment that way.
I think it was Dr. Shepard's very calming aura, and everybody else's, the amazing receptionist who held my daughter the whole time so that I could be back there with my son, and all of the dental assistants. Just their calming effect had such an effect on my son, where they let them put on the headphones and he just laid there and he let Dr. Shepard work inside of his mouth.
We do not want to be sedating children unless there's a legitimate medical, dental reason to do so. Sedation has risk, and it's a risk that we shouldn't take unless it's absolutely necessary.
Just the other day I had a parent bring in a 3-year-old child who had been in another office and sedation had been recommended. We talked over some options and kind of met with the family and decided that it would be best to try with just a little laughing gas and be able to fix a few teeth that way. With a little help of nitrous oxide or laughing gas and a movie, we were able to help this little kiddo and get him out the door without any issues.
I fix teeth on children all day long who parents, other providers, friends of mine would probably never think and consider doing on a child with their eyes open. I've had many 2-year-olds where I've numbed them up with laughing gas only and extracted a tooth that broke due to trauma. And they walk out of the room with a balloon and a toothbrush in their hand, and they're happy.